Doing well. I'm Dr. Milind. So one question that I'm getting through mails and messages in the last few days is about studying the big four subjects for medical entrance examination. So here I'm going to share a few tips about tackling these big four: medicine, surgery, PSM, and OBGYN when you prepare for your NEETPG. Definitely, this the portion is vast, and studying and revising these subjects is difficult. So what should be our strategy to tackle this subject? So first of all, we should understand that these are the rank maintaining subject, and these subjects are actually never going to decide your rank. So they are going to maintain your rank. So I divide subjects into three categories: your rank building, which are your basic sciences, starting from your art, physio, biochemistry, pathophysio, pharma, along with your pediatrics, ENT, and ophthalm. So I call them rank building subject. These are rank maintaining. Once you have built your rank, these subjects are going to maintain that rank, and then there are rank deciding subjects, which are your short subject. So I had decided this subject in three groups, and I have released video about this in detail as well. You can find it in the channel video list. So as this subject have a vast syllabus, so what should be our approach? It should be cautious. If you start reading medicine page to page, you will never. It's like never ending. And again, to revise and retain this much of information is tough. So what we should do is we should focus first on the must do topics. So, what are these must do topics? So, I have just listed here uh, in this slide. You can see the topics. So, what I have observed over last 4 5 years, the exam which I wrote, also the previously asked questions which I have seen over the few years, you will see the same topics are repeatedly being asked. It's not like they will ask just random topics. There are some topics which have a higher weightage. So, whenever you start reading your medicine, you should read in this order. So when you open your notes, you start first with your connective tissue disorders and vasculitis, about their diagnostic markers, the pharmacology, the drugs that are used, their side effects, and about the histopathology and radiological appearances. So definitely these rheumatological and connective tissue disorders have a higher weightage, and if you see the questions that are being asked again and again, the questions from these topics asked. After that, you finish your acid-base disorders, followed by cardiovascular disease, then hematology, about anemias, the images about the peripheral smears, about other coagulopathies, then about some oncology, endocrino, CNS. So what happens that when you finish, let's say you have finished till your CNS, let's say you have assigned 8 to 10 days for medicine. Now you have at the 10th day you are here till CNS. So now you can actually move on to other subject, because you cannot afford to give unlimited time to subject like medicine. Now you'll say, sir, what if we miss these topics? See, again, as I have said, the weightage of these topics is very less as compared to the other topics. Also, the thing about medicine is not something, you see, if you want to be MD medicine, it's not like you should be a master of medicine as a subject. If you want to be a surgeon, it does not mean that you should be a master of surgery. You have to be a master of basic sciences to actually pursue these branches. What you can see in medicine is lot of questions of medicine actually can be solved from your knowledge from physio, patho, pharma, and microbiology. Let's, for example, infections. Lot of questions like clinical questions, actually these are formulated along with your micro knowledge. Lot of questions of other topics are also already covered in your patho and physio. So even if you read, if you even if you give less time to medicine, actually these questions can be tackled. Now again, if you talk about, so this is actually should be a strategy. So you can take a this list, and this is not something that I have prepared. If you go through the all the classes, all the PYQs, you will find the same order. Now if you talk about next subject, that is surgery, again you will see, if you open the last 4 5 years questions, you will see again this order is being followed. You'll see a lot of questions asked about the breast, thyroid. Again, the third is GI surgery, again a very favorite topic. Recently, over the last 5 6 years, trauma has become the and the critical care surgery has become a favorite topic of examiners, and a lot of questions from that area are being asked. So you should first finish this topic. So once you're done with these topics, then at the end you can actually read the less commonly asked topics. So once you're done with these topics in this order, you can finish these topics in the days that you have allotted, and you can again move on to the next subject. Similarly for obs and gynae. So gynecology, again, anatomy of the female genital tract, about menstruation and related disorders, abnormalities of the congenital anomalies of the genital tract, then gynecology, the oncological chapters in gynecology, then about the infertility, infections, STDs. Again, very the topics again and again asked. So if you are done with these topics, you don't actually have to worry a lot about your this subject. Again, about the obstetrics, they will ask about the shape of the pelvis, the anatomy of the pelvis, about the fetal skull, about the labor, about the ectopic pregnancy, about the contraceptions. Lot of questions about the contraception. A lot of questions about the clinical these conditions that happens during pregnancy, about the diabetes, thyroid, about the anemia in pregnancy. And you will see the same kind of questions are asked again and again. So if you're thorough with these topics, you can first finish these topics in the number that you have allotted to obstetrics and gynae, and then you can move forward. If we talk about PSM as well, again the statistics. A lot of students they run away from the statistics, but if you are especially preparing for INI statistics, you will see a certain number of statistics, a basic biostatistics question, which will give you definitive marks about the epidemiology of the disease, about the screening of the disease, all the sensitivity, specificity, positive predictive value, negative predictive value. Again and again, you will see this kind of questions, national health programs and policies, some questions about the biomedical waste. So you can see these questions again and again appearing in the exam. So instead of covering this subject page to page, make sure you at least finish these topics first, and these are in a descending order. So the topics which are in the upper part of the list, you should finish them first, so you don't miss out on something. As I said, it's not possible to finish this subject in total. So if you look at the previous exam, so this is one of the last year's exam which I have taken number of questions that were asked. So you'll see that basic sciences have a good number of questions. So if you give more time to that, and it's easy to cover them as compared to the large subject. So if you have a good command on your basic sciences, you don't have to worry about your big four. Around 28 questions of medicine actually, these 28 questions can actually be solved from your medicine knowledge. So the numbers which are given in black are usually the expected number of questions from the subject. The red number of questions are actually the number of questions that came from that subject or can be solved from the knowledge of that subject. So you can see that medicine around 28, surgery around 25, PSM around 26, ophthalmology around 26. So actually there is a lot of overlap. But what is thing about medicine is all of out of these 28 questions of medicine, 80 to 90% of the question actually can be solved with the knowledge of your physio, biochemistry, pathopharma, and micro. You don't need to just read medicine to get those questions right. Surgery also a lot of questions can be solved through your knowledge of your anatomy and ENT. There is always overlap. And again, PSM and OBGYN, there are a lot of topics which I have shown are repeatedly asked. I mean, these are the high yield topics. So if you have a good command on them, lot of questions out of these 26 questions of PSM and OBGYN, lot of questions can be solved if you do these must do topics. So this is the way actually you should tackle the big four exam the subjects, and this is how a lot of students have done it. So guys, I hope this video will be helpful for you, and if you have any confusion or any doubt, you can ask me in the comment section. So I wish you all the best and take care.